Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind every sleep complaint is a real story, and today's topic highlights something many people dismiss for far too long: loud snoring, poor sleep, nighttime choking, chest discomfort after midnight. Because sometimes what looks like ordinary snoring is actually the body struggling for oxygen during sleep. And the warning signs rarely begin dramatically. That is why we approach it from four perspectives: what the doctor evaluates, what the pharmacist safeguards, what the dietitian supports, and what you at home can recognize early and respond to properly. This is your nursing perspective. There is a pattern we often see at home. It usually begins quietly. It happens at night. A person snores loudly at night. They wake up tired even after many hours in bed. They fall asleep easily during the day. Sometimes they wake suddenly, gasping or choking. At first, it seems harmless. Maybe I'm just tired. Maybe I slept badly. Snoring runs in the family. And for a while, the symptoms come and go, but the pattern continues. The snoring becomes heavier. Sleep becomes more interrupted. Morning headaches begin. Energy levels drop. Concentration becomes difficult. Then another layer appears: nighttime chest discomfort, palpitations, restlessness during sleep. And at that point, it is no longer just poor sleep, it is a breathing pattern. And from a nursing and home care perspective, the first step is simple: observe before you react. Pay attention to loud, persistent snoring, pauses in breathing during sleep, choking or gasping at night, restless sleep, morning headaches, excessive daytime tiredness, difficulty concentrating, nighttime chest discomfort, because patterns often appear long before complications develop. Now understand what may be happening. During sleep, the airways should remain open so breathing stays smooth and continuous. But in some people, the airway repeatedly narrows or collapses during sleep, breathing temporarily stops, oxygen levels fall. The brain repeatedly struggles to wake the body just enough to breathe again. And this cycle may happen many times through the night. So even though the person is sleeping, the body is not truly resting. Now, the system begins to shift. Poor sleep strains the brain. Low oxygen stresses the heart. Blood pressure may rise. Fatigue becomes persistent. And nighttime symptoms become more frequent. Everything is connected. Now look at what worsens the pattern: heavy late night meals, alcohol before bed, smoking, sleeping flat on the back, weight gain around the neck and abdomen. All of these can make nighttime breathing more difficult. Then another pattern appears: poor sleep leads to low energy leads to less movement leads to weight gain, and weight gain further worsens snoring and breathing. And gradually, the cycle deepens. So think like a nurse at home. Notice how often the snoring happens. Observe choking or pauses in breathing. Pay attention to daytime exhaustion. Watch for repeated nighttime waking. Notice chest discomfort that appears mainly at night, because the pattern is the message. Now support the system at home. Maintain regular sleep routines. Avoid heavy meals late at night. Reduce alcohol and smoking if present. Try sleeping with the head slightly elevated. Avoid lying completely flat if symptoms worsen in that position. Encourage healthy weight control where appropriate. And prioritize proper rest and hydration, because small nighttime habits can strongly affect breathing and sleep quality. Now know when to seek medical attention. Do not wait if you notice repeated choking or gasping during sleep, pauses in breathing, severe daytime sleepiness, chest pain or pressure, difficulty breathing at night, confusion or fainting, persistent morning headaches, bluish lips or fingertips, sudden worsening fatigue. These are not symptoms to ignore. They may be signs the body is struggling for oxygen during sleep. Final point: snoring is not always just noise. Poor sleep is not always just stress. And waking up exhausted every day is not something to normalize. Sometimes the body is sending a signal long before serious complications appear. So observe the pattern, support healthier sleep habits, and seek proper evaluation early, because early attention can protect the heart, brain, lungs, and overall quality of life. Need guidance? Contact your healthcare provider for proper evaluation or call /WhatsApp plus 233 208 700 and 2347. And remember to explore the other three perspectives because each one completes the picture.